Hey everybody. So today I'll talk about anxiety. So anxiety is one of those topics that everyone is pretty familiar with in terms of what it feels like. They may not know always how to describe it. So when you think of anxiety, what first comes to mind for you? It's one of those topics that it can mean a little bit different things for everyone. They can uh, kind of describe it to each other. But it can mean that you're stressed, it can mean that you're frustrated, but most of all, people can get pretty overwhelmed by it. But people present it to each other in different ways, and most everyone can kind of tell something is going a little bit wrong. People kind of can tell, but sometimes people can cover it up a little bit better than others. And it's kind of varies. Some of the symptoms of anxiety is a rapid heart rate, uh, rapid breathing. Some people sweat. Some people are nervous when so they'll start shaking. That's different signs, different symptoms that people present. Sometimes people's mouth gets really dry. Some people's voice quivers. So you'll see this, you'll hear this, and it's presented very differently to people. So again, you'll notice it, but you may not have always been able to identify each of these symptoms. Most of the time, people can tell, but it's not something to get alarmed about. But a lot of times people do, and it's one of those things of life. So it's pretty common. Um, what does it mean to you? How do you deal with it? So everyone deals with it a little bit differently. Sometimes people take medication for it. Sometimes people go to therapy for it. And then oftentimes people do both. So it's like a combination effect. Um, One of the things that I hear quite often is people who will be told, just calm down, it'll be all right. That that's one of the worst things that you can tell somebody if you're watching this video in an effort to help someone, and then if you're watching this video as a person who is trying to receive help because you have anxiety, that makes it worse. It frustrates you, and most of all, it gives you no solution. It gives you no solution in the short run, the moment, and it certainly gives you no solution for the long run. So if you have been to therapy, then hopefully if you've been to therapy for this reason, for seeking out help for anxiety, you've been given both quick or short term and long term solutions for the treatment. So for short term treatment solutions, um, breathing techniques, that's one very quick way or in the moment ways to deal with anxiety. So this is this is a structured breathing technique. You may be given different breathing techniques, timing of breathings, deep breathing. So that's the very core of this. And so when you breathe deep in particular rhythmic patterns, that also most of the time affects your heart rate. So sort of the cardiopulmonary system is affecting two body systems. So think about when you're being very active outside or inside, physically active, then your breathing and your heart rate are coincide. They working together. So that's where that comes from. So it's really pretty unique in that way. So of course, that's why when somebody says, just calm down, just calm down. Oh, okay, then I'll just do that. No, it doesn't work like that. So that's more of the in the moment, quick way to deal with that. Um, so So one way. Another way is thought stopping. Thought stopping does not always work for everybody. It's maybe more so for somebody who has very strong cognitive skills that they can really take control of their way of dealing with things. So you're being conscientious of what it is that you're thinking about, what it is that's making you very anxious. So it's just being conscientious of what it is that you're thinking about and really taking control. I have to stop thinking about this. I know what it is. I know what it's doing to me. Let me, in essence, kind of distracting yourself, but it's more of being present, being aware of what it is that's causing the dysfunction. So it's interrupting that spiral of thoughts that you're presently having. Sometimes it's so strong that you have difficulty in doing that. So that's some of the short-term solutions. So long-term solutions, you can do more of some mental work. Compartmentalization. So what is that? Compartmentalization. In your life, there's so many things that you think of that seems like it all comes crashing down. So what can you put together in an order to declutter your thoughts? How do you give yourself some structure? What can you categorize? So a lot of times people think in a very abstract way. So when you think in an abstract way, it can cause some dysfunction. Some people do just fine thinking that way. But it can cause dysfunction in day-to-day life because if there's no particular order, then maybe that leaves out the structure of it. So that's one way. Kind of leads into the next way of looking at things is prioritization. Put some priorities on things. A lot of times people who maybe are very task driven, what they'll do is they'll put pretty much everything at top priority. Everything gets number one. Well, you're only but one person, so you can't put everything at one. So if you have to make a list, if you're a list maker, go ahead, make a list. But you have to be aware that not everything can get at one as far as being able, everything can't get number one. You have to put something at 2 and a 3. So that also helps with time management. So if you're somebody who is really good at being able to put priorities on things, but you have struggle with getting it all done within a timely manner, well, then this can help you with being able to do that. There are other ways to help manage all of this. Anxiety does not just reside in what I've mentioned, and I will include some more in a part 2 video. If you have other ways and treatments and solutions that you'd like to include, or if you have questions about these, put them in the comments section below. Also, subscribe to my channel and give me a thumbs up and hit the bell so you'll know when my next video is coming up. But stay tuned for part 2.